Hello everyone. So my name is Kamal and from today onwards I would like to teach you your community health nursing. So we'll start with the unit 1. So unit 1 is introduction to community health nursing. So before starting the topic I would like to introduce you some of the key terms that we come across the subject when we are going further. So firstly we'll see what is a community. So since we are discussing regarding the community health nursing, first of all you need to know what is community health and what is community health nursing. So we'll see what is community first of all. So here group of people who were living together in a definite area, means in a same place with particular characteristics in common, means all these characteristics, means the way they behave, the way they speak, the way they dance, the way they eat, everything will be in a common manner. So they will be having similarities. So these are nothing but the number of, means the group of people who are living together in a same area having same type of characteristics in common is termed as a community. Then what is meant by community health? So here the health which is mainly related to the people who are living in the community. So here we can say it is a field of public health. So the people who are living in the same area, if they are called as public. So what is meant by community health? It is a field of public health in which what we are doing, the public health, we are mainly focusing on the improvement and health characteristics and biological communities. So we are saying the community health, it is a field of public health and is a discipline, mainly it is concerning about the improvement of health characteristics of biological communities. Mainly it is focusing on the health aspect of the community, means the people who are living together with similar characteristics and with similar thoughts, so and with similar working habits. So these people, we are mainly focusing on the health of those people. So it is called as community health. Then what is meant by community health nursing? Means nothing but it is a field of nursing which is blending the primary health care and nursing practice with public health nursing. Means we are mainly blending, means we are applying the nursing techniques in the field of primary health care. So it is mainly focusing on the improvement of the public health. So hope you understood these three terms. So what is community? Group of people living together in the same place and having particular characteristics in common, they are called as community. So here we are focusing on the health of the community. So mainly we want to improve the health characteristics of these biological communities. So this is called as community health. So applying the nursing principles in the primary health care is termed as community health nursing. Then what is meant by health? So it is a state of being free from illness or injury. So when we go further, I will explain you what is the definition of this health according to the WHO and other terms. So we'll see now, as of now, what is meant by health. It is a state of completely or merely free from illness or injury. When a person is free from an injury or an illness, it is said to be a health. Then what is a disease here? An illness that affects a person, it is called as a disease. So what is health? The state of being free from illness or injury. And what is disease? An illness that is mainly affecting the person, it is called as a disease. So what are all the dimensions? Means coming to the dimensions, so it is a aspect or feature of a situation. Means dimensions means for every object we have dimensions. For example, if it is a rectangular shape, it has 4 dimensions, 1, 2, 3, 4. In such a way, for health, for everything we are having some kind of dimension. So we have health dimensions, we have health determinants. So in that way, here dimensions mean nothing but a feature of a situation. And nextly, coming to the determinants. So here what is determinants? Means a factor which decisively affects the nature or outcome of something. So for example, if you need to understand the situation, if you need to understand the topic, what is the determinant here? First of all, you need to understand my language. So here, based on my language, your understanding ability will be varied. So if I say properly, then you will understand, then the outcome is good. If I don't say properly, you cannot understand and the outcome is wrong here. So what is the determinant here? The way of teaching is one of the determinant. The way of language using is one of the determinant. The way of technology using is one of the determinant. So based on these elements, based on these determinants, based on the quality, your outcome is differentiating. So this is determinant. Then coming to the spiritual. Spiritual means nothing but it is relating to a religion or religious belief. So it is always into your psychological aspect and your psychological belief. Then what is a concept? Concept means nothing but it is a general idea. So if you want to understand something, for example, I need to make you understand what is community health nursing. So I need to have a concept. So first of all, what I have taught you what is community, then what is the community health, then what is community health nursing. So if all of a sudden if I start you saying community health nursing, you cannot know, you cannot understand what is community health nursing. First of all, you need to know what is community, then what is health, what is community health, so what is nursing. So if you know these three terms, when we say community health nursing, then simply you can write your answer. Means the field of nursing which is blend of primary healthcare and nursing practice with public health nursing. So in such a way you have to write. So this is one of the concepts. So my concept is, after teaching you something, you will learn the level 2. After learning the level 2, again you will learn the level 3. So that is what an idea or an understanding or something which is there mainly to make the students or mainly to make the people to understand, it is called as concept. We'll see what is biomedical concept. So here in this concept, what they are saying, we have different types of concepts which are related to disease. So here biomedical concept means whenever an organism, means a pathogen means nothing but the disease causing organism. So we will get fever. When we will get fever, whenever we got infected by anything, any organism or any insect, then we are having the fever. So in biomedical concept, so what they are doing, illness due to the entry of pathogenic organism in the body, they will say biomedical concept. So because of the environmental sources, if anything which is capable of infecting the human being, if it is entering our body and if it is causing us to feel illness, this is called as biomedical concepts. Then what is ecological concepts means due to the environmental pollution, because of the environmental pollution that is caused by us or due to the machinery or due to any kind of thing, the concept is called as ecological concepts. Coming to the health promotion. So here what we are doing, we are mainly focusing on the promotion of the health. So we want to improve the quality of the health of the people. So this is health promotion. So these are some of the key terms that we are going to encounter in our lesson. Hope you understood these key terms. Coming to the definitions, what is community health, and what is community health nursing. So first of all, we'll see what is community. So as we have seen in the key terms, what I said, group of people living together in a similar area, in a same area with similar characteristics is called as community. So here a community, if you take the introduction part, so community, it is a social unit. So it is sharing common values. Common values means, suppose we have Bengali community. Why all Bengalis are staying in West Bengal? Why all Telugu people are staying in Andhra Pradesh? And why all Hindi speaking people are staying in Mumbai or Maharashtra? So why? So the characteristics, because we speak the same language, because we do the same things, because our eating habits are same, we all people, see in Andhra if you come, the people here will like idli sambar, vada, dosa, but if you go to West Bengal, it is entirely different. You will like poha. Am I correct or not? So here, based on the characteristics, here the people who are living are having similar type of characteristics, similar type of habits, the way they speak, the way they represent their self is common in way, and the values also. And these people, they are situated in a given geographical area. So this is called as community. Example for this community means village or town. For suppose if you take in our state, if you take our villages, the people who go for fishing, so their lifestyle is, they will wake up early in the morning, they will have some food, they will prepare their boat and they will go for fishing. If they are farmers, so they will wake up early in the morning, they will worship their God, they will pray to their God, they will go to the field and they will work. So the farmers, they live together in a definite area. The fishermen, they live separately. correct or not? And the other persons in the community, depending upon their work basis, they try to stay separately in a group. So these groups are having similar characteristics, similar habits, and they are having definite geographical boundaries. So this is a community. So here community, it is mainly affecting the health status of the people. So here the community health, it is including both private and public efforts of the individuals, groups, organizations, mainly to promote, to preserve the health of those in the community. Mainly we are focusing in a community health nursing, we are mainly focusing on the health of the people who are living in the community. Either it may be a village or town or city. Here private organizations or governmental organization or public effort, our main aim is to protect, our main aim is to promote, our main aim is to preserve the health of the people, those who are living in the community. So this is meant by community. Nothing but it is very simple, very clear, group of people who are living together with a definite geographical area, with similar characteristics, similar habits, and sharing common values. These people are called as a community. What is the example of community? Example of community is village or town. If you go to one village, the characteristics, if you go to the village where the fisherman lives, so there the characteristics of those persons who are living in the particular village, it will be similar. It will be very similar. The values they give, it is very similar. So this is called as a community. So here, before you understand what is the concept of community health nursing, first of all you need to understand what is community health. So here mainly the community health, if you see, the primary motto of this community health is mainly to promote the well-being. So here if you see the public health, community health, so what is our aim? We are mainly focusing on the well-being, means nobody in the community wants to get diseased, nobody in the community wants to get died before the actual age, or nobody wants to get and go and simply hospitalized. So here mainly our motto, the community health motto, is to improve the health of the people. So it could be like physical, mental, social aspects of people who are living in the community. So a person is said to be health. So before you go to the topic, first of all you need to understand what is the health definition. So the health definition according to the WHO is, health is a state of complete physical, mental, social well-being, and not merely an absence of any disease or infirmity. So here the community, before you study what is community health, I would like to say you what is the definition of health according to the WHO. So what is the definition of health according to the WHO? Here according to WHO, health is a state of complete physical, mental and social well-being, and not merely an absence of any disease or infirmity. So what is the meaning, what is the actual meaning of this health? Means here a person is said to be healthy whenever the four aspects, physical, mental, social and psychological, so whenever these aspects are meeting, all together without any kind of disease or infirmity, then we are saying the person as a healthy person. So you understood what is the definition? Health is a state of complete physical, mental, social and spiritual well-being, not merely an absence of disease or infirmity. So before you understand this concept of community health nursing, so you should know what is community and what is community health nurse. So we understood what is community, nothing but group of people living together in a same geographical area with same values, same characteristics and similar thoughts. So here coming to the community health. So as we have learned what is health, health is a complete state of social, spiritual, physical, psychological well-being, not merely absence of any disease or infirmity. So that is what called as health according to the WHO. So here the community health, it is referring to the promotion of well-being. So in the psychological aspect, in the physiological aspect and in the social aspect, mainly the people who are living in the community. So here if you see mainly if coming to this unit which we are discussing now, it is mainly giving us the information about the definition, what is the description of community, what is the function, role, what is the culture, what are the ethics, what are the values to consider in the community. So we'll discuss one by one. Now let us get into the topic. Hope you understood what is a community. So I have introduced the topic till now. So this is what a community meant to be. So in a village, the group of people are living together. So these people will live together in a definite geographical boundary. So they won't be scattered, they will be scattered inside the geographical boundary, and these people will share same values, same thoughts, same ethics, same principles and similarity in their lifestyle. So these people are called as a community. Example, a village or a town. Now we'll see what is a definition of a community. So here if you see the definition of a community according to the WHO, according to the World Health Organization. So here a community is a social group determined geographical boundaries and or common values and interests. Its members know and interact with each other. Its functions are in particular structure and exhibits certain norms, values and social institutions. So this is what a community is meant by WHO. So here if you simplify this, social group, it is a social group with determined, see these number of people are living together in this particular area. So here the people, they are talking with each other, they are sharing their food habits, okay, they are exhibiting similar types of norms, they are exhibiting similar type of values and their social institutions. So this is what called as a community. And the definition, and if you see this definition, this was given by WHO in the year 1974. So hope you understood what is the definition of a community. Now we'll see what is a community health. So mainly community health, it is referring to the health status of the members of the community, to the problems affecting their health and to the totality of healthcare provided to the community. So if you see here in the mid 20th century, they have changed the term public health to community health. That's what here if you see that they are saying the public health in the first slide. So in the mid 20th term, means in the 20th century middle, they have changed the term public health to the community health. Why they have changed it means because of the changing nature of public health that focuses on individual responsibility and community participation. So this is community health. Coming to the community health nursing, so here the community health nursing pays more attention to nursing services that were provided to the community as a whole. Now we'll see the definition of community health nursing according to the American Nurses Association. So here if you see the American Nurses Association, so community health nursing, it is a synthesis of nursing practice and public health practice which is mainly applied in promoting and preserving the health of population. The nature of this practice is general and comprehensive. So this is the definition which is given by American Nurses Association. So here nothing but it is a synthesis of nursing practice and public health practice. Mainly we are applying our nursing health practice and public health practice mainly in the promoting aspect and the preserving aspect of health of the population. And what is the nature here? The nature of this practice is general and comprehensive. Now we'll see what is the definition that is given by WHO mainly to the term community health nursing. So here simple, the meaning is same everywhere. Applying of this nursing practice, applying of the nursing practice in the view of meeting the needs of individuals, families and communities in this normal environment. So what is the normal environment? So mainly at home, at school and the place we work. This is our community. I'm correct or not? So whenever we apply our nursing practice and skills that were mainly focusing on the health needs of individuals, either it could be families or communities, where at home, at place of work and at school. So this is called as community health nursing. This is the definition given by WHO. Please take note of these definitions. They are very important. So this is the definition for community health nursing and this is the definition of community health nursing that is given by ANA, and this is community health and this is the definition of community. Nextly, we'll see what are the aims of community health nursing. So what is the aim of community health nursing? Mainly, as we have seen here, what is the main aim of community health nursing? If you see what is community health, it is mainly focusing on the well-being of the individuals. Am I correct or not? It is mainly focusing on the well-being of the individual. So mainly to improve the quality of life, to improve the standard of living, to strengthen the self-care activities of individuals, to reduce risk factors. So what is community health nursing? Here the main aim is to improve the quality of life. So if the quality of living is increased, if the quality of living standards are increased, ultimately we will be free from so many diseases. So here, how to strengthen our self-care, how to do our life activities, so it is mainly based on the individual base. So community health nursing, it is mainly focusing on strengthening the self-care activities of individuals in the community. So whenever we are leading a quality life, whenever we are improving our standards of living, and whenever we are able to perform our self-care activities, we will ultimately reduce the risk factors. So if the risk factors are decreased, then the disease rate is also getting decreased. So these are the aims of community health nursing. As we are saying, to improve the quality of life, to improve the standard of living, to strengthen self-care activities of individual, and to reduce the risk factors. So with this, I would like to end the topic here. So in next class, I will say you what are the concepts of health and disease, what are the dimensions and indicators of health and health determinants. Thank you so much for watching. So if you like the content, please like, share and subscribe. And if you have any queries, please drop them in the comment box, or you can contact me in the WhatsApp. Thank you so much. Thanks for watching.